You are what you eat, especially when you're trying to get a baby. What you eat greatly determines your fertility. Proper nutrition is important for fertility. The presence of environmental pollution, chemicals, and pesticides in our foods greatly affect fertility. About 11% of women struggle with fertility worldwide. Some of the foods you can eat to boost your fertility include foods rich in folate, and folate is important for making your red blood cells. It enables your body to make enough blood as it prepares for the baby. Folate decreases your risk of ovulatory infertility, where your body does not produce an egg to allow for fertilization. Some foods rich in folate include asparagus, oranges, corn, whole grains, peanuts, avocados, and green leafy vegetables. Folate also promotes healthy cell development and decreases the risk of neural tube defects such as spina bifida in your baby. For carbohydrates, those with low glycemic index, which are also termed as the good carbohydrates, are encouraged. They are slowly converted to sugar, which causes moderate amounts of insulin production. They also decrease the risks of developing gestational diabetes, that is, diabetes in pregnancy. This includes whole grains, brown bread, brown rice, and breakfast cereals. Carbohydrates with high glycemic index, such as white rice, white bread, and processed snacks, are rapidly converted to sugars in the body, which causes increased insulin production. Research shows that increased insulin levels in blood inhibits ovulation. Therefore, it will interfere with your ability to get pregnant. Calcium is also important when you're trying to conceive. It protects the bones of the mother from osteoporosis and fractures in pregnancy. Calcium is also important for the development of the bones and teeth of your baby. Research also shows that calcium helps one to conceive faster. Some of the foods that are rich in calcium include whole milk, yogurt, cheese, soy milk, green peas, sardines, and broccoli. Proteins are also important for synthesis of fertility hormones, enzymes, and cells. Plant proteins are healthier and preferred. Research shows that increased intake of animal protein increases the risk of ovulatory infertility by up to 40%. If there is need for animal proteins, low intake should be considered, and the animal should be grass-fed and not treated with hormones and antibiotics, which may disrupt your fertility. When it comes to fats, plant-based and seafood fats promote regular ovulation and fertility. The omega-3 fatty acids improve blood flow to reproductive organs, and they can be obtained from seafoods such as salmon, sardines, and tuna. For plant-based, nut oil, grapeseed oil, olive oil, and avocado oil is healthier. Studies show that women consuming monounsaturated fats in form of avocados during in vitro fertilization have high success rates by 3.5 times compared to those consuming animal fats. Animal fats also increase insulin resistance, where the body produces insulin but it's not utilized. High insulin resistance causes metabolic disturbances such as obesity and diabetes, which may affect ovulation. Zinc is also important for sperm production and ovulation. It improves the egg quality, cell division, and progesterone production. and progesterone is the hormone that will help maintain your pregnancy. Some of the foods that are rich in zinc include oysters, oats, poultry, beans, lentils, sunflower, and pumpkin seeds. Fruits are also important when trying to conceive. Pineapples are rich in bromelain, which supports implantation. Colorful fruits have antioxidant properties which neutralize free radicals in the body. The egg and sperm are highly sensitive to free radicals, hence need colored fruits in order to help neutralize these free radicals. They include blueberries, oranges, lemon, raspberries, and even beetroot. Beta-carotene, which is the deep yellow and orange pigment in carrots, helps encourage cell growth and hormonal regulation. It also increases progesterone, which will sustain pregnancy. Research also shows that beta-carotene helps prevent from miscarriages. Above all, stay well hydrated as water is essential in follicle and egg development. It also aids in transporting hormones which are important for fertility in the body. Avoid alcohol and caffeine as they may cause hormonal imbalances. Smoking cigarettes decreases your chances of pregnancy by up to 40%. Also practice proper timing with sexual activity. You are most fertile during your ovulation days. Active exercise also boosts fertility and ovulation. Also manage any stress you may have as it might affect your ovulation cycle.